Another reason I'm not a huge fan of PRP is I do think that if you take a patient that has a lot of the diffuse loss, like where I said it does have some benefit, and you inject that stuff, you can really cause like a bad shed. And I think you'd mentioned you had maybe some bad shedding with it. And I've seen some patients that have had some really bad shedding, and you can almost get like a shock loss from it. And if those hairs are weak enough, they might not come back from that. So long story short, we stopped doing it, not because it's not lucrative, not because you can't see some benefit in some patients, but because I think over time it's harmful. I think you're going to see not even like a net neutral. I think you're going to see a net negative in these patients that do enough PRP over time.
I think that a lot of guys who are doing dermarolling PRP, if you're going to need a hair transplant, and that's okay. Like if you're going to need one, it's fine. But why would you want to destroy your scalp with dermarolling, with PRP? Because then you're making it less available for accepting of those donor grafts, right? So you're trying to plug a donor graft into a scarred area, which we know doesn't take. Even guys who get the strip, they'll have that strip put in with FUE, which is great. It can work. The first time typically goes around that they don't take because, like you said, you're so scarred up, you can't accept the sub-Q tissue.